Diabetes, a complex web affecting millions globally. This video will delve into the intricate signs of diabetes in women, unraveling nuances often overlooked. Scientific understanding of these signs is vital for early detection and control. In a world where information is crucial, we will dive into the depths of this condition to equip you with knowledge. Before we proceed, subscribe to the channel and hit the notification bell to stay informed about the best for your health and well-being. Without further ado, let's embark on this enlightening journey. 1. Excessive thirst and dry mouth. Let's begin our journey with the classic signs of excessive thirst and dry mouth. When blood glucose is high, the body tries to eliminate the excess through urine, leading to dehydration. This vicious cycle results in a persistent feeling of thirst, a clear signal to be attentively considered. Diabetes, at its core, is a metabolic condition where insulin, the key hormone for glucose absorption by cells, is inadequate or ineffective. Insufficient insulin leads to glucose accumulation in the blood, causing symptoms like extreme thirst. The dehydration resulting from the body's relentless effort to eliminate excess glucose intensifies the sensation of a dry mouth. Therefore, if you find yourself constantly seeking relief for thirst, it may be the body alerting to potential metabolic imbalances associated with diabetes. 2. Frequent urination. Our second point of analysis involves frequent urination, a signal often underestimated. The root of this symptom lies in the body's attempt to expel excess glucose. As the kidneys filter blood to remove the additional sugar, more fluids are directed to the bladder, resulting in frequent urination. Excessive glucose in the blood acts as a powerful osmotic, attracting water to the bladder. This not only increases the volume of urine, but can also lead to nighttime bathroom visits, disrupting the sleep cycle. Therefore, if your nights are marked by frequent bathroom trips, it may be a silent manifestation of the body seeking metabolic balance. 3. Constant hunger. Constant hunger, our third point of exploration, is an intriguing manifestation of diabetes. The root of this symptom lies in the cell's inability to absorb glucose adequately, despite its abundance in the blood. Glucose is the main energy source for the body, and its efficient absorption depends on insulin action. In people with diabetes, insulin doesn't play its role effectively, resulting in hungry cells despite the apparent availability of glucose. The body, sensing the lack of cellular energy, signals the need for more food, resulting in constant hunger. This continuous intake of food, despite abundant glucose, can lead to unwanted weight gain, another component often associated with diabetes. Therefore, if insatiable hunger persists, it may be time to explore metabolic health more deeply. 4. Persistent fatigue. Persistent fatigue, our fourth point of analysis, is a direct consequence of metabolic imbalance in diabetes. To understand this phenomenon, it's essential to envision how glucose plays a crucial role in energy production. Glucose, when properly absorbed by cells, is converted into energy through a process called glycolysis. However, in the presence of diabetes, where cells resist glucose entry, the body faces an energy deficiency. This leads to a persistent feeling of fatigue as cells, deprived of their primary fuel source, struggle to function efficiently. Moreover, diabetes can trigger other mechanisms contributing to fatigue, such as the release of stress hormones in response to metabolic instability. Therefore, if fatigue becomes a constant presence in your life, it's prudent to investigate the possibility of underlying metabolic challenges. 5. Unexplained weight loss. Unexplained weight loss, our fifth point of consideration, may seem contradictory to the common association between diabetes and weight gain. However, this phenomenon is deeply intertwined with cells' resistance to glucose. When cells cannot efficiently absorb glucose, the body turns to the breakdown of fats and muscles for energy. This results in weight loss, often noted even in individuals with increased appetite due to constant hunger. Therefore, if you're experiencing weight loss without an apparent reason, it may be a crucial sign of metabolic imbalances associated with diabetes. 6. Recurrent infections. Entering less obvious territory, we consider recurrent infections, especially on the skin and gums, as a sixth indicative sign of diabetes. The relationship between diabetes and the immune system is intricate, with metabolic imbalance making the body more vulnerable to infections. Excess glucose in the blood can feed the growth of bacteria and fungi, exacerbating the risk of skin and gum infections. Additionally, diabetes can compromise the immune response, making the body less effective in fighting off pathogenic invaders. Therefore, if infections seem to be a constant presence in your life, even with proper precautions, it's proof. 7. Slow wound healing. Slow wound healing, our seventh point of analysis, sheds light on the connection between diabetes and the tissue repair process. The effectiveness of healing depends on a complex interaction between cells, growth factors, and blood vessels. In diabetes, high blood glucose can damage blood vessels, restricting blood flow to affected areas. This compromises the efficient delivery of essential nutrients and repair cells to wounds, resulting in slower healing. Moreover, diabetes can negatively influence collagen production, a key protein for skin integrity. The combination of these factors contributes to the persistence of open wounds and increases the risk of complications. Therefore, if your wounds are taking longer than usual to heal, even those considered small, it may be a revealing sign of metabolic imbalances associated with diabetes. 8. Changes in vision. Changes in vision, the eighth topic in our exploration, point to the complex interactions between diabetes and ocular health. The effects of diabetes on the blood vessels of the eyes can lead to visual complications, with diabetic retinopathy being one of the most common. Diabetic retinopathy occurs when the blood vessels of the retina are damaged by excess glucose in the blood. This can result in blurry, hazy vision or even vision loss in more severe cases. Additionally, diabetes also increases the risk of other eye conditions, such as cataracts and glaucoma. Therefore, if you notice changes in your vision, it is crucial to consider an eye examination, especially if you are at risk or already diagnosed with diabetes. 9. Changes in menstrual patterns. We conclude our exploration with a less explored topic, changes in menstrual patterns. While not a universal sign, some women with diabetes may experience irregularities in their menstrual cycles. The hormonal imbalance caused by insulin resistance can affect the menstrual cycle. This can manifest as irregular cycles, amenorrhea, absence of menstruation, or menometrorrhagia, excessive menstrual bleeding. Therefore, if you observe significant changes in your menstrual patterns, it may be an indication to investigate possible metabolic challenges associated with diabetes. As we unravel the complex signs of diabetes in women, realize that this knowledge is a powerful tool for prevention. If this content resonated with you, subscribe to the channel for more insights into health and well-being. Together, we can build an informed community. Subscribe now and be part of this educational journey.